Aloha. Thank you so much for being here. So happy to have you. Um, so again, great to have you here. My name is Dr. Catherine Taketa-Wong. And for those of you who aren't familiar with naturopathic doctors, I'm a naturopathic doctor and an acupuncturist. And I'm very excited. I'm really excited about today's topic. Today, we're going to be getting into digestive um, conditions and talking a lot more about how we can be able to help you. Um, so we'll be getting to more details, but just by way of introduction, so again, I'm a naturopathic physician and ND, and like medical doctors, NDs attend a four-year medical school, and we're trained as primary care physicians. I order lab tests, write prescriptions, and do school physicals, the same as any other doctor. I'm also a licensed acupuncturist and trained in Chinese medicine. And just so that you know, the typical conventional medical school that trains medical doctors offers about 19.6 hours of training in nutrition. By contrast, naturopathic doctors receive 155 hours and are trained in the power of nutrition to build health from the inside. So that's really a strong foundation of what I do in working with patients. And doing things that way takes a lot more time than just prescribing a pill. So my office visits are a full hour. And I became a doctor because it really is my passion to help people not only get well, but stay well. And that is really why I love treating my patients. I love working with my patients and helping them to be able to get better and stay better. And I believe so strongly in the power of being a partner in people's healthcare. There are three pillars that form the foundation of my practice. They are one, to heal, two, to educate, and three, to empower. My patients and I are in a partnership for health. My protocols and guidance, added to their commitment to improving their lives, enables them to be empowered about their health. And that means that they learn how to be more energetic, how to heal their illness, and how to feel happier. If you have any digestive problems or really any health issue, I just want to ask, wouldn't it be great to be free of that condition? If your answer is yes, please go ahead and contact me for a free phone consultation. There's no charge because I don't take patients without talking to them first about their health conditions. I always make sure that we come up with a plan that helps you the most. To schedule a time to talk with me, just call or text our office. All the contact information is here on our Facebook page. You can talk with me personally about any health concerns that you may have and about how to feel empowered for your health. Today's event is about some serious digestive conditions, the new cutting edge test that I use for diagnosis, and how I help patients with Sibo, IBS, and other digestive issues regain their health. We don't spend enough time talking about digestive issues, probably because many people find it awkward to talk about their intestines and their gut bacteria, and especially poop. So, can you imagine that? People feeling awkward talking about poop? So, our intestines are vital to our health. And if they don't work well, we can really be in trouble. It's how our body receives its nutrients and removes its waste. Nutrients flow from the small intestine to the bloodstream and to our cells. Waste moves into the large intestine to be removed from our body. That's important stuff, and it is stuff that we need to feel more comfortable talking about. Our event today is about some serious diseases of the intestines, what causes them, and how cutting edge science and food based healing combine to successfully treat them. The good news is natural medicines and food-based healing are the foundation of my training and practice. I specialize in bringing the small intestines and the entire digestive system into a healthy and sustainable balance. After all, without a healthy, functioning digestive system, we can become susceptible to many illnesses, not just digestive ones. So let's start first by talking about just some basics about what's going on in our body. We have large intestines and we also have small intestines. We are supposed to have lots of bacteria in our large intestines, but not in our small intestines. The small intestinal bacterial overgrowth, which is called by the acronym SIBO or SIBO, that is a condition that we're going to be talking about as the main topic of our focus today. And this is a condition that typically occurs when something, for example, surgery or disease or opioids, acid blockers, or other medications, can cause an overgrowth of bacteria in the small intestines. The excess bacteria in the small intestines can cause symptoms such as abdominal pain, nausea, constipation, diarrhea, gas, bloating, cramping, nausea, or feeling too full after eating. SIBO is a condition that unfortunately conventional medicine has been slow to recognize and successfully treat. But in fact, SIBO affects 60%, or sorry, it affects 20% of Americans and 40% of all gastrointestinal patients. It can also present in up to 70% of all cases of irritable bowel syndrome. And irritable bowel syndrome is basically just a name for this condition where people have all of these digestive symptoms, the nausea, the bloating, cramping, abdominal pain, things like that. Our body has safeguards to prevent the bacteria from overgrowing in our small intestines because, again, when those bacteria overgrow, then that's when they can cause a lot of digestive symptoms and a lot of problems. So SIBO occurs when those safeguards fail. Besides the ones I already listed, other causes include not having enough digestive enzymes, liver or gallbladder problems, and also immune system problems. If you can't digest your food well, your energy gets drained, your mood can turn sour, and it can be really hard to concentrate. And if you can't poop normally, you may not feel like eating, and you could develop chronic diarrhea or stool that's hard and painful to pass. Many of my SIBO patients have symptoms that really make their lives miserable, and you might be dealing with some of those. I've had patients whose diarrhea is so bad that they feel like they're glued to the toilet all the time, especially with diarrhea or foul smelling gas. Going out to eat with friends can be really embarrassing and isn't fun. And so people tend to isolate themselves, they avoid social interaction and contact, and it can become a really big problem. So, what to do? Um, you know, another thing is that many of my SIBO patients have symptoms that also really make their lives miserable. Sometimes their diarrhea um, is not only embarrassing, but it can also make them really afraid to eat. There's also bloating, especially with women. They may have a thin body, but their stomach can be so swollen that they get asked if they're pregnant. Other patients suffer from continual painful cramping and constipation and find it really difficult to get anything done. And that may be what you're experiencing. One patient told me that the cramping was so painful that he wound up on his bed in the fetal position for hours at a time, and trying to pass stool would literally take hours. This patient was also afraid to eat. He started eating less and less in order to avoid the cramping, and that made him lose a significant amount of weight, which in his case, he couldn't afford to lose. He also didn't know what to eat and what not to eat. And people with SIBO often feel really confused and lost. Um, so maybe you're feeling that way. You're afraid to eat, or you don't know what's going to cause or trigger your symptoms. I've been talking about adults, but sometimes children also have these kinds of digestive conditions, particularly if they have any of the things that I mentioned that can be contributing factors, like, for example, certain medications, acid blocking medications, or other kinds of medical conditions. One of my specialties is pediatric medicine, and I have a wealth of experience working with children. I've been in practice for 10 years and I've worked with literally hundreds and hundreds and hundreds of children. If you are a parent, you know how important that is. For example, a doctor may have good knowledge of treating SIBO in adults, but they may not know much about pediatric digestive conditions or how to be able to effectively help our children deal with these conditions if they have SIBO or other digestive problems. So again, um, depending on the age or their development, a child may not be able to tell their parents what they're feeling. So we have to look at their behavior. This may manifest, for example, with pressing on their stomach, on the edge of chairs or sofas because their tummy hurts. Especially in feeding children with autism or other special needs, the child may not be able to say what's bothering them, and they may have a hard time explaining it, or they may just not feel like talking, or they may not have the ability to be able to share that. Fortunately, their behavior always tells me a lot, and so that's one of the things that I really digestive conditions that they are dealing with. Um, And some of the other things is that the medical community sometimes does get behind the curve on certain conditions, with patients trying drug after drug without success, at times leaving them with a mistaken notion that no good options exist. And many of the patients that I've treated with SIBO or irritable bowel syndrome or other digestive conditions have already tried conventional approaches. Thankfully, um, natural medicine has many different options that conventional medicine doesn't offer. Conventional treatment for SIBO typically relies on a round of antibiotics to kill the overgrowth of bacteria. One third of patients have their SIBO symptoms resolved after the antibiotics, but two-thirds feel better after doing the antibiotics only to have their symptoms come back and become chronic. So if you're suffering with digestive symptoms, you may have been to see your primary care doctor already. You may have seen the gastroenterologist, and they many times don't even know about SIBO or test for SIBO. If they do, they may have just offered you a single round of rifaximin, which is a common antibiotic that will treat SIBO, which can be helpful. But it, again, in many cases, two-thirds of cases, often after they finish the round of antibiotics, then their symptoms just come right back. And often the gastroenterologist hasn't presented anything in terms of what do they do to change their diet, how can they prevent it from coming back, what's the next steps after they do the antibiotic. There's often no guidance there. Um, and um, so thankfully, natural medicines and food-based healing form the foundation of my training and practice. I guide my patients to long-term relief in two ways. First, to successfully treat their SIBO, we develop and implement a specific science-based menu to nourish them. For SIBO patients, the right food is a form of medicine. Second, we work up a regimen of medical grade supplements and herbs to augment the SIBO specific menu. Digestive tract problems can be a complex challenge, so I'm always looking to be a medical detective in order to determine what tests to use, how to interpret them, and the best protocols for successful treatment. Just a few months ago, a cutting edge test was released that more accurately diagnoses what can be causing SIBO. It helps to pinpoint the problem and also allows treatment protocols to be more targeted. I'm pleased to let you know that I was one of the first in the nation to use it for my patients. We'll get back to today's event called Dr. Taketa-Wong uses cutting edge testing to naturally treat SIBO, IBS, and more. But for those of us who are just joining us, if you have digestive problems or really any health condition, I just want to ask, wouldn't it be great to be free of that condition? And if you're saying yes, please go ahead and call me for a free phone consultation. There's no charge because I don't take patients first without talking to them first. I always want to make sure that what I do fits their needs. We talk with you about your health conditions, your concerns, and then come up with a plan to see how I can help you the most. To schedule time to talk with me, just call or text the office. All the contact information is on our Facebook page. You can talk with me personally about any health concerns that you may have and about how to feel empowered about your health. I'm really excited to tell about the Sibo test and why it's such a game changer. There are 3 different types of Sibo. For those of you who are familiar with Sibo, you may also be familiar with these terms. There are hydrogen and methane, and there's a third type, which is called hydrogen sulfide. So up to a few months ago, we could only test for the first 2 types, hydrogen and methane, but we didn't have the ability to find out if the patient had the third type, hydrogen sulfide, and see how bad it was and the extent. That type, the third type, hydrogen sulfide, is treated with a completely different menu and completely different herbs and supplements often. With this new test, we are more able to effectively diagnose SIBO patients and provide the right kind of treatment. Some patients who are now my patients looked up SIBO online to find out what kind of foods to eat in order to get better. The result was that they became very confused because there are a lot of different diets online that claim to treat SIBO. So please, if you think that you have SIBO, don't use the internet as your physician. People with SIBO really need guidance because, first of all, they need to find out what type they have. Secondly, it can often take more than a change of diet alone to effectively treat SIBO. If you have any of the symptoms we've been talking about, here's how I typically treat my SIBO patients. We first use the new cutting edge test to be able to determine what kind of SIBO you might have or if you have SIBO at all. This is important because you could also have large intestinal bacterial overgrowth or small or large intestinal fungal overgrowth. You could have undiagnosed food allergies or sensitivities. And also, you might not be making enough digestive enzymes to break down or digest your food. If you do test positive for SIBO, we find out what type. In fact, it is possible to have more than one type. The next step is to find out what foods you're having problems with. After that, I would work with you to design a menu that you feel comfortable sticking with to start. Once we've done that, I would design a treatment plan made individually just for you. Often I use the best quality medical grade herbs to kill a bacterial overgrowth. I sometimes use antibiotics and specific types of probiotics and prebiotics. You may read online that if you have SIBO, you shouldn't take any probiotics or you shouldn't take any prebiotics at all, that those will cause problems and make SIBO worse. This is not true. Research has found that there are specific types of probiotics and prebiotics that are helpful with treating SIBO. However, it is true that some types of probiotics and prebiotics should be avoided and can cause problems. So it is important to use certain supplements to be able to treat specifically and also to prevent SIBO from coming back. So we design a regimen, again, that goes through the foods that you eat, also herbs, supplements, and then creating a plan with specific kinds of supplements to prevent the SIBO from coming back. Let me just close with a story about a patient that I worked with who had SIBO. We'll call her Abby to protect privacy. So when Abby first came to see me, she had horrible digestive symptoms. She had nausea after just about every single meal, chronic diarrhea, chronic stomach pain. She was tested for food allergies and she came back with allergies to almost everything except for 4 foods. Abby was afraid to eat because almost everything made her stomach hurt. She tried a diet that she found on the internet for a week, but that didn't really help much. And of course, she lost weight because there were just times when she couldn't eat because she had too much pain. Abby went to a gastroenterologist, but they weren't really able to come up with anything that helped her very much. Once Abby started working with me, we tested her for SIBO and she did test positive. We worked out a customized menu for her and started her on a tailored program of herbs and supplements. Today, Abby has been able to reintroduce a lot of foods back into her diet. Her menu is much wider and she enjoys eating again. She has no fear of foods because she knows exactly what she can and can't eat. And as long as she sticks to the program, she has no nausea, no diarrhea, and no stomach pain. Her life is completely different because she talked also about how isolating it was and how she would never go out to eat with friends. And it was just really hard to be able to engage with her other friends and always having to know where the toilet was. And it was just really embarrassing. And so she would isolate herself and wouldn't go out much with friends. But now she has, I mean, with COVID, not her regular social life back, but she is able to work and go out and eat somewhat to a certain extent with eating out. And she has said it's just completely different. Like her life has just changed in that she is free from these digestive symptoms as long as she stays away from those foods that she eats. And it's just been a complete life changer for her. So I trust that our discussion about SIBO has been useful to you. You're welcome to talk with me personally about any digestive problem or other health concerns that you may have, and especially about how to feel empowered about your health. That is a huge key. And that is absolutely why I love working with patients, because it is so rewarding to see patients getting better. So again, just call or text our office to schedule a free phone consultation with me. There's no charge because I don't take patients without talking to them first. I always want to make sure that what I do can fit their needs. You'll find all the contact information here on our Facebook page. So mahalo for joining us. Thank you again for being with us, and we will see you again in 2 weeks. Aloha.